Hello, my name is Dr. Jacqueline Ubani. I'm an electrophysiologist here in Orange County, and I'm here to talk to you about the subcutaneous ICD. So, you've recently been diagnosed with heart failure despite being on medical management for over 3 months and despite having undergone some kind of cardiac intervention. Now, your physician is telling you that you need a defibrillator implanted. What is a defibrillator? Well, first of all, let's talk about heart failure. So normally, the function of the heart is to pump blood that contains oxygen nutrients to all the organ systems in the body so that it can function normally. Normal heart pump function, we say, is about 60% or greater. That is, the heart is squeezing and getting at least 60% of the blood out. When your heart pump function is less than that, that's considered heart failure. Now, if your pump function is about 35% or less, you're at high risk of having one of these malignant and lethal arrhythmias called ventricular fibrillation or ventricular tachycardia. These arrhythmias lead to instant death because at this point, your heart is not pumping any blood and oxygen. And as a result, your brain and the rest of your organs aren't getting oxygen and nutrients, and that results in instant death. So what the defibrillator does is it just sits in the body and it just monitors your heart for any of these abnormal rhythms. And if your heart goes into one of these rhythms, it then shocks you to keep you alive. I'm sure you guys are all familiar with watching movies where you see patients in cardiac arrest being rolled into the emergency room, and you see the doctors doing CPR or any healthcare person doing CPR. And then the next thing you see is them putting defibrillator pads and shocking the patients to revive them. So that's exactly what this defibrillator does. It just detects and shocks you out of a bad rhythm to keep you alive and to keep you alive and potentially prevent death. Now, there are two kinds of defibrillators out there in the market. There's the transvenous ICD, where you have leads placed inside the heart. And then there's the subcutaneous ICD, which is a system that's completely external to the heart. Now, you have to sit with your physician, and based on your medical history, your physician has to decide which one of these two defibrillator systems works best for you, given your medical condition. Now, if your doctor does decide that you need a subcutaneous ICD, this is what the device looks like. It consists of a can and a single lead. This can is slightly bigger than the transvenous ICD, but with this system, like I mentioned earlier, you have nothing inside the body. You don't have any leads, and you don't, inside the body. This system is strictly outside of the body. The can itself is implanted in the mid-axillary area, which is just below your underarm. And the lead is tunneled underneath the breast and onto the breastbone. The procedure is actually pretty simple, can take anywhere from 30 to 45 minutes. And there's very, very minimal complications associated with the procedure. X-ray is actually not even needed for the device implantation. After you get the device, some physicians send patients home that day, and others keep you overnight just to get adequate pain control. By the next day, you get discharged with instructions on how to take care of the wound, which is pretty simple. And then after that, you just follow up with your cardiologist every 3 to 6 months to make sure everything is okay. Thank you.